Okay, so the next thing we're going to look at, so now we know that teeth are numbered. We know that teeth have associated sides. Think of a house. A house has four walls and a roof. A tooth has four sides and a top. So the top on a back tooth, if we click on, let's say, number 19 here, we highlight it, and then we can look at this. These are all the abbreviations that describe the sides. So if we have like a west wall or an east wall or a north wall or whatever, we kind of have something similar. So we have something called mesial. Mesial side of the tooth is the side that's facing towards the front or the median line of the patient's mouth. Now, because the arch is like a horseshoe, our teeth go towards the median line. So it's the front side going towards that median line. And just look this up on Google and you'll see illustrations of what median is. But it's more important that you know what mesial is. Distal would be towards the back of the tooth. So we have mesial, distal. Then we have out to the cheek. We describe that as facial or buccal. So it's either coming out towards your facial side of your face, or the inside, which we would call lingual, which is your tongue, all right? So the tongue side, or palatal, where on the upper beams, it's on the tongue side, but on the upper arch. So let's go through this again. We have the four walls: mesial, towards the front median line; distal, towards the back, away from the median line; facial, or buccal. Buccal is the lower cheek area here. It's out to the cheek area, out facially. And then lingually would be towards the tongue side, or palatally would be upper. Now, the top part of the tooth has two terms. It depends on whether it's a front tooth or a back tooth. On the back teeth, we call it the occlusal side. So that's an O, or occlusal. And that's why it's right in the middle of this right here. So the O and the I. The I is for front teeth here, where we say that's the incisal edge, because these front teeth don't have an occlusion really to them. They have a cutting, like scissors. So I call these front teeth the scissor teeth, or the anterior teeth are the cutting teeth, and the munching teeth are these ones in the back. The posterior teeth are the munching teeth. So we have O or I for the occlusal or incisal. Then we have buccal or facial here. Then we have mesial distal, or mesial distal, and then we have lingual here. Now we have this one last letter, which is a V. The V is not a V. It's a V like a Roman numeral V. It's called class 5. And that's a specific type of cavity, which happens to be a cavity at the gum line. Typically, it's a class 5 that's always on the facial or buccal side of the tooth. So when we say V or 5, that's why it's on this side of the chart. See, this 5, class 5, is on the buccal facial side of the tooth. But every once in a while, you'll see a cavity on the lingual side, and some people might describe that as a class 5 on the lingual side. But it might get a little confusing because it's not really proper. Proper would be class 5. We understand it is a cavity at the gum line, and it's not a cavity on the side up high on the tooth, but it's right at the gum line. Now, who gets those? People that drink a lot of sugar cereals or sweets and things like that that are in their drinks, or dry mouth patients get a lot of those types of cavities. So that's what this all means here. And one last thing on the enter treatment part here is you want to enter a treatment plan for existing work that's going to be done. If this is work that has already been completed, then you have to click on completed. So then anything you enter off this tooth will register as a completed case. Now you go down further, it says existing current provider. So the current provider is the one that did the existing care. The next one down is existing other. So an other doctor did this work. So typically we go through existing other, or we do treatment plan. Those are the two main ones that we typically do. So existing other is just if the patient's a new patient and then we're just charting them for the first time what they came in with. So we know where they started. We'll show you how to take pictures, so then we document actually what the patient did come in with.